So when we're looking at this chart, this is also pretty old at 2012, but looks at chance of pregnancy based on sperm concentration. Once you get up to over 50 sperm concentration, between 50 and 100 million per milliliter, there's a little bit of a percentage jump, maybe 2%-ish, 3%, but it's pretty steady, right? And then anything over 100, which like I've never seen, actually that's a lie, I have seen concentration over 100, very, very rare, but they're all kind of hovering around that 20%, which is what we know. Statistically, we have a 20 to 25% chance of achieving pregnancy each cycle. It's not that high, which is what makes all of the little things that we can tweak that much more important, right? And when we look at the sharp increase in this chart, if we were to split this down at the like 25 to 30 million per milliliter range, we're up at about 15% chance. It's then not that much of a huge difference between 30 and 50. So if you're anything below 30, we're having a very, very steep decline. And if we were to go back, remember that our normal value is 15 million per milliliter. And if we were to estimate that's probably about here-ish, we're looking at maybe a 5% chance of pregnancy with a 15 million per milliliter concentration, which, hello, fifth percentile, 5%, right? It makes sense. Why are we accepting a 5% chance of achieving pregnancy as normal? I have no idea. I would love to know. I think, am I missing something somewhere? Like when we are trying to get pregnant, we want to maximize our chances of getting pregnant. And sperm concentration is something that is just not held in a super high regard in our standard clinical testing settings. And that's not okay. Because like I said at the beginning, it's leaving a lot of couples being told that it's not male factor, when in fact, it might not be male infertility, but it's male subfertility. And we're seeing a huge, huge boom in subfertility across couples. And you guys that are in that range of like, your numbers aren't super bad, but they're not great either, and they're not optimal, you're getting left behind because the doctors are just telling you, well, keep trying, it'll happen, your numbers are fine, there's nothing wrong, when in fact, there is a lot of room for improvement. So first things first, if you haven't had testing done, please go get that done because the data is going to help us build you out a curated plan for you. Instead of you just taking 25 supplements that have been touted for sperm count, let's actually know what's right for you. Let's do the testing and build that out together and make sure that we have a good understanding of the specific strategies that are right for you. Then if your numbers are not optimal, meaning 50th percentile, AKA 60 to 70 million per milliliter, we know that there's room for improvement. And like I said, based on that last chart, realistically, anything over 30% is pretty decent. Like we're pretty close to that 20% chance, but the closer we can get to 100, the better. And if you're not anywhere near that, the first step is to figure out why. Then we fix the why. It's super simple, but sometimes you just need a little bit of guidance.